If you're out there and you're pretty good with your diet, you haven't made many different changes, you didn't have a bunch of sweets, but you're seeing your blood sugar spike. I want to address a few other things because other things can cause blood sugar spikes outside of just eating sugar. So let's do some obvious ones. Number one, if you look at low sugar or no sugar added types of foods, especially packaged and processed foods, that doesn't really address the carbohydrate content. So if you're having something that like a low sugar, no sugar added granola bar, that carbohydrate content can certainly raise your blood sugars, and we wouldn't really call the granola bar sweets. And if we looked at it and it says organic, no sugar added, we wouldn't say that that is necessarily junk food, but from a blood sugar standpoint, it's still going to be very, very carb heavy. So, other factors, sometimes too much protein or the type of protein that you're having. Don't get me wrong, protein is probably the number one thing I tell my clients to focus on, but you could have way too much at any one sitting or any one meal, and that excess could cause some blood sugar spikes. So some patients have told me, it's like, whoa, what's going on here? I had a really low carb meal, but maybe they had like a little extra too much chicken and steak and this type of stuff. So they saw that blood sugar spike, and we have to dial that in a little bit. Or types of protein, especially soy-based protein and dairy-based proteins and whey-based proteins. These typically have quite the blood sugar spiking effect. Now, how much of that, in my estimation, is the very protein itself and maybe some of the things that come with it? Like if you get a whey protein powder, that's very different, and there's typically other things other than just the protein in that container. So we have to evaluate those, but especially protein powders. This is why many practitioners like myself want people eating whole foods, meaning the way God gave it to you. If it's a piece of meat, we eat the piece of meat. If we are having fruits and vegetables, we eat the fruits and vegetables, and not a refined, processed version, packaged form of it whenever we possibly can. So think about this. If you have a protein powder, it is ground down into a fine, fine powder. So when you drink that protein shake, it absorbs through your gut lining so much faster, hitting your bloodstream, than if you had a piece of protein. If you had a piece of steak, fish, chicken, this type of stuff. So we want to eat it in our whole form, not the refined processed form. Not to say there aren't some good protein powders out there and some better versions of it, but too much protein or types of protein is what I'm getting at, could spike your blood sugars. Other things, stress. Stress can certainly do it because when you're stressed, you can promote more inflammation. You can release stress hormones. I'm going to say this a lot with stress: cortisol and adrenaline. And these two hormones that come from your stress glands, your adrenal glands, they'll raise your blood sugars and blood pressure. So we see this a lot with adrenal and stress hormone issues. If you're a type 2 diabetic where you go to bed at a certain blood sugar and you wake up higher, sometimes that's a hormonal imbalance. We call it a dawn effect. And a lot of that drives back to your adrenals, and you're releasing some of these stress hormones at the wrong time. So, stress is a big one. Caffeine. Caffeine is a stimulant which stimulates these adrenal stress glands. Same thing, you can release some of that. It also, too much caffeine can decrease your insulin sensitivity. So now we're not regulating the blood sugars as well. Other things that people can investigate on: why are they seeing blood sugar spikes even when they're on a low carb approach? Medications. If you look into many blood pressure medications, you're going to see that they add to insulin resistance or they add to making your diabetes worse. Cholesterol and statin medications, a lot of psychiatric medications or antidepressants, anti anxiety. As a good practice out there, if you're on these other medications, go to Google, type in the medication and insulin resistance, okay? Or does this medication increase insulin resistance. It's a good practice to do that to see what other factors or other drugs or prescriptions that you have might be adding to your diabetes and blood sugar imbalances. So those are some of the key ones: excess protein, medications, stress. One I didn't hit: poor sleep cycles. It all comes back to you're not repairing, you're not healing, more inflammation, more breakdown, more stress hormones. If you've ever tried to go through a busy day and the night before you didn't sleep well, or maybe kids woke you up, or something happened to where maybe you only got 3 hours of total sleep, and you're just, I got to go to work. I got to push through. I got to take care of the kids. What's going on? You're running off of stress hormones. You're running off of cortisol and adrenaline to get through that day. So those are probably some of the most common things that I see that can spike people's blood sugars. Of course, the sedentary thing. If we're consuming a normal amount of calories, but we're not up and moving and burning those things, you can certainly get spikes there. Infections, sickness, illness. So a lot of times you might get like the common cold and flu. You might get a UTI infection or a bladder infection or a yeast infection, and you're going to see your blood sugars go up. Now, a lot of times when we have different issues too, not, I'm jumping around a little bit, but if we go to medications, let's say you have aches and pains, or you have bad knees and it's really painful. You go in, they give you a steroid injection. I know a lot of you have maybe gotten cortisone creams, steroid injections, and after you take that or receive the injection, you see your blood sugars go up. So there's a lot of other factors than just eating sweets and having sugary foods that can spike your blood sugars. So definitely evaluate those other factors.